got some more cards here to play that'll make a book. So I play the hand that's been dealt with me. And so this is the hand that we've been dealt, and this is the hand that we're going to play. And so we're going to talk about HIV and reproductive justice in a time of COVID. And so you can go to the next slide. And so I want to talk about, I will talk about a little bit about, I just really want to be focused on HIV and women and reproductive justice in women living with HIV. I think it's really important that we talk about that, because so often when we're talking about reproductive justice, folk immediately go to abortions. And while abortions is a part of reproductive justice, because reproductive justice is the right to parent, it's the right for folk to parent. And I'm not just saying women folk, but it is a right for folk to parent. That is whoever is going to parent. It is definitely the right to have full bodily autonomy. And let me tell you, sometimes folk living with HIV are denied full bodily autonomy. And so it is so important. So reproductive justice is so important, and we demand that folk have full bodily autonomy. And so it is the right to parent, the right to not parent, and also the right to parent with resources to do all these things, and also being able to define what family look like for you. And so we oftentimes, folk don't get somebody else define what family look like. And so you have the right for full bodily autonomy and the right to define parenting. And so this first slide just kind of talk about reproductive justice. It is for the full expansion of women being and upholding the full spectrum of what that looks like. And that is including what I said earlier, when and how to shape and form the families. And these things, and reproductive justice can only exist when folk have been empowered with self-determination. Self-determination is huge when we're talking about HIV, because sometimes when folk get diagnosed, self-determination is they're sometimes robbed of self-determination. And then other folk want to determine what their destinies is, and other folk want to determine that based on a status, or based on gender, or based on race, or based on all of those things. And so we want to make sure that folk have social, economic, political, cultural power, so that they can make meaningful decisions about their bodies, sexuality, relationships, reproductive choices, and have power over institutions. So that's another thing. Sometimes, institutions tend to believe that they can dictate how we come into the world and how we show up. And so reproductive justice address that full spectrum of things. And at the Afia Center, we really focus on socioeconomic and political arrangements of power and how they show up in folks' lives. And so how does that fit in with COVID? Think about it. Think about what we're gaining. Oh, they need me to speak up. Can you hear me now? Whomever it is want me to speak up, is that better? I don't always talk loud, y'all, so I'm sorry. And so it's very important that so in a space of COVID, so COVID is basically robbing us of a lot of things. And it is increasing risk of a lot of things, right? Because people are not in a position where they can move around so that they can make choices that they would typically make. We're being stuck in spaces with folk that we wouldn't typically be stuck with. It is impacting how we get access to our health care, our medical care. It is all of those things are being impacted. Our lives is being impacted by this. Our ability to work is being impacted by this. All of these things, on top of the fact that we're living with our HIV diagnosis, living well with it, but still living with it. And so there are times, so everybody's not at the same space, right? And so folk are having to go out and be in spaces where they may be forced to talk about their HIV diagnosis at a time when they're not ready to talk about their HIV. People may not go in and out of hospitals the way they used to go in and out of hospitals because of this. And then there's this little bitty tiny thing that's attached to COVID called stigma that's also attached to folk living with HIV still. I am talking to people, and you can move it to the next slide. I am talking to people who's ashamed to let people know that they have COVID, or somebody in your family has COVID. And where does that come together? People getting an HIV diagnosis in times have decided that they were not going to go to the doctor because of the shame that was attached to it, which led to them having health complications that they would not have had they not been ashamed to go to the doctor. There are people who don't want people to know that they are living with COVID. So thereby they are not going to the doctor. They will not go get tested. They do not want to deal with the shame that's attached to that. They don't want anybody to know. What does that do? When people are living with HIV and they don't quite know how to articulate that and they cannot get around shame, that means they may engage in some things that may put other people at that other people may become at risk for and I don't know if risk is the right word I'm supposed to use, but that may expand what that risk category can look like, because it is that stigma that's attached to going and being diagnosed, or that stigma that's attached to stay in care. Okay, COVID. People don't want anybody to know that they're living with COVID because we have already attached stigma to COVID where it should not be. And so that means that you are in places and you are in spaces where other people who are around you or who are enjoying your time and your company, now they can also, it creates a larger risk factor for them. That is not your intention. It is those are some of the dangers that stigma bring in. So we in the HIV community, we are used to this. We've seen this before. And so we are kind of be working with the tools to overcome stigma. So the same way that I educate folk around HIV, I do the same thing when I try and make sure that folk have all the knowledge that they need around COVID so that they can live life in a better way for themselves. And also race and gender and class, all of those things, because the further you are from white, the more devastating your COVID is going to be in your life. The further you are from white, the more devastating your life is going to be when you're talking about HIV. The further you are from the margin, and we know the margin for the better part is white men. So anything outside of that is outside of the margin. And so the further you are outside of the margin, the more impacted you're going to be by all of these things. And it's going to impact your ability to make a living. It's going to impact your ability to be a part of your family. Right now, people are negotiating if they're going to be in Thanksgiving together with their families. And so COVID is impacting us. So it creates a whole nother kind of isolation. And so HIV tends to create isolation, especially for women. Reproductive justice, and so I was talking about when we look at reproductive justice and folk living with HIV, we talk about there being a support for building of families. And so reproductive justice extends to parenting and custody rights and all of these things. And so, and I'm trying to mix both these presentations together, COVID and reproductive justice and HIV. Many times, can you go to the next slide? Because I'm going to pull them both together. Many times there are barriers that we face that prevent us from parenting. Many times there are barriers that we face that prevent us from parenting. And for many times, for folk living with HIV, systemic barriers to realizing their full sexual and reproductive justice in this current system, can you go to the next one? In this current system, political and legal and economic system, can impact how parenting look. It can impact our ability to parent. It can impact our ability to parent even when we are not going to biologically have a child. It can impact all of these things. And these things are impacted by systems, political systems, economic systems, systems of power, where power is not evenly or equitably distributed. And so if we are not prepared to have these kinds of conversations, then reproductive justice provides us with what we need in order to have these kinds of conversations. Folk have to be able to make meaningful decisions about their bodies. And this is all folk. I was in a board meeting a couple of weeks ago, and my board chair happens to be a woman, a woman of trans experience. And all of these years, she's been a part of our work. And I talk about bodily autonomy, and I talk about this, and I talk about that. And she asked me a question, how does parenting, how does that look for her? What does it mean, when she's been faced with challenges as it relates, challenges, political challenges, systemic challenges, challenges with law. When she's driving down the street, she's had an incident where she's driving down the street and the police or some person thought they needed to call the police because they didn't understand the relationship inside of that car. They didn't need to understand the relationship inside of that car because that was not their car. That was the people inside of that car. But anyway, she wanted me to talk more about that. And I was able to tell her, that's what bodily autonomy means. That's what it means, that you get to show up in the world as who you are, and you get to choose what family look like. And nobody get to choose that for you. And systems don't, and you get to express whatever you feel like you need to express. And nothing gets in the way of that. And we have to make sure that when we are talking about reproductive justice and HIV, that we are very expansive in our conversation. We just cannot make this be womb centered. Because when we do that, we are then allowing for systems to dictate how people move around. And all of this stuff have everything to do with HIV. It has everything to do, and COVID impacts us in that same way. And it makes the decisions that we have to make in our lives right now even more complicated. Because we're fighting those systems of oppression. We are fighting systems of reproductive oppression. And there's value or non-value being attached to our ability to reproduce. And so that's what I was talking to my board chair about. You're not valued. The world don't see you valued because of what they feel like your inability to reproduce. But the ability to reproduce is not the only way in which we have families. You can go to the next one. And these systems should not be dictating that. So I'm going to get ready to close because I promised I could do this in 18 minutes. And I have been working really hard to get this in 18 minutes. This is like this is probably the 18th time I've done this, because I've done it 17 times trying to prepare. But one of the things we keep in mind, policing of sexuality and HIV criminalization, that is a place where this HIV and reproductive justice intersects, and sometimes criminalization gets in the way of us choosing how we are going to parent, how we are going to how we're going to show up, how we're going to express our gender, and all of these things. And these things can lead to dire outcomes for our lives. They can literally lead to ending our lives. And because these systems don't value our lives, and that policing of that, when our lives are lost, then people don't get too upset about it, because there has been no value in the beginning, and there has been no people understanding that we have to have bodily autonomy. That is a must. That is a plus when we do this work. It's not hard to expand reproductive justice to the fullness of what womandom and whatever, and gender non-binary folk, and gender non-conforming, and trans women, and cis women. It's not that hard when we just really look at it as what it means to have full bodily autonomy. It is not that hard to have this conversation and be very inclusive when we're talking about folk that are living with HIV, who have the right to parent also, who have the right to not parent, and who also have the right to parent with all of the resources that they need in order for their families to be healthy, even inside of COVID. Nothing is supposed to change. It's supposed to get better, not worse. Lack of access to HIV prevention and quality healthcare. I talked about that earlier, y'all. Let's think about that a lot, because the data says that we're doing better. Women are not the numbers. Sometimes I debate that, but this ain't the show I'm gonna do that on. But anyway, we're doing better. But how do we stay better? What are those numbers going to look like after COVID? Are there going to be new HIV diagnoses? Do people have access to where they can be tested? Do they know that they can have this access to? Are there really safety measures being put in place to make sure that people get to get tested, and also making sure that people have full access to full reproductive health care? We get phone calls from people living with HIV who needs an abortion, just like we get phone calls from people who are not. We get phone calls from people living with HIV who want to have access to doulas and midwives and be able to birth in the safest way that they possibly can. just like folk who don't, because there should be full and equal access. And right now, inside of COVID, people are really wanting to have children, wanting to birth at home and in safer spaces. And so we have to make sure that we are doing this work in a way that people living with HIV also know that this is a safe space for them. They also get that same level of safety inside of this tumultuous time that we find ourselves living in. And then gender-based violence and trauma and PTSD, that is a huge part of this work, and reproductive justice so eloquently cover it, because if we are not, if we don't have full respect for folk and allow folk to have full bodily autonomy and respect that, gender-based violence comes so easy. It is just an easy thing for folk to feel like that they have a certain level of control based on gender or how they see gender, and they get to harm people. And people looking around don't get so upset about that harm, because it's like, oh, it's just a woman, or it's just a trans woman, or it's just a this, or it's just a trans man, it's just a that. But no, gender-based violence, if we're not really respecting bodily autonomy and letting folks show up in a way that it is safe for them to show up in all aspects of their life, then gender-based violence becomes so easy. And the trauma that happens when we deny folk these rights, the trauma that happens, there's a whole lot of folk are traumatized over this election last week. Those systems that's not necessarily designed to protect us. And reproductive justice call those systems out. We have to have all of those things if we want to have full and equal, if we want to really have the fullest attainment of human rights and social justice. And people are experiencing PTSD. It is a real thing. I talk to people, I see people all the time. And so full bodily autonomy, being able to show up in the world in the way that's you, and not having to explain to people why and how. If you want to have children, I'm ending with this. 218, y'all, look at that, look at God. And if you want to have children, nobody gets to tell you that you cannot have those children, that you cannot adopt those children, that you cannot define family in the way that you want to define family, and however family looks for you. Nobody gets to tell you that you can't. You have a right for that. And you have a right. You equal you and all that good stuff, honey. That means folks can start having some real good, pleasurable sex. How about that? And they get to have fun in that sex. And then sometimes something may happen in that sex, like it may be an unintended situation where you have the right to not have to carry a whole person inside of you for a whole 9 months. If you don't want to, because living with HIV don't deny you the right to make that choice either. And if you should decide that you're going to do this, you're supposed to be able to do it with all the resources. You're supposed to be able to do this in a way that you are absolutely safe in a time of COVID. You're supposed to be able to do this with access to housing, affordable housing. You're supposed to be able to do this with access to education. You're supposed to be able to do this with access to living paying jobs. You're supposed to do this being able to go to the polls and vote in a safe manner. You're supposed to do this in all of these ways because you are allowed that, because those things that I just talked about are literally basic human rights. And that's where these things come together. It is to not deny folk a basic human right based on gender and race and class and all of those things. And that's it. I'm done. I don't normally get done on time.